Hi everyone, we are now with Rachel Wall from Inspired Hygiene. She's here today to talk to us about herself, her company, and all the great things that are happening. So welcome, thank you for coming to talk to us at DentalEDU.TV.
Thank you for having me, it's a pleasure.
Great, how you feeling today, all right?
Great, yeah, feeling good.
Wonderful, let's talk a little bit about yourself and how you got into the business.
Well, I've been a hygienist since 1991, so almost 20 years, and have remained clinically active and started doing coaching and consulting and training about 10 years ago. I started Inspired Hygiene in 2004, and it has just steadily grown. In the last year and a half, we've just really seen a big boost in our business, and it's really exciting. It's a lot of fun.
Give me an overview of your company.
All right, so what we do is we do in-office coaching. We do webinars, teleclasses, all types of different training and continuing education opportunities. But the biggest thing we do is we really help dentists tap into the profit potential of the hygiene department.
Okay, great.
While taking outstanding care of their patients.
I want to talk a little bit about the trends that you see these days now in the hygiene.
Yeah, so what I'm seeing these days, in our economy is that dentists are really looking at the numbers closely. They're really analyzing their numbers, and they want to make sure that all their systems in the practice are really shored up so that they're doing the best they can with what they have to work with. And a lot of times that hygiene comes into that. They want to make sure that their hygiene department's taking absolutely the best care of their patients. Because right now, it's really about taking great care of our existing patients. It's really almost as important as attracting new patients.
Okay, what would be the number one reason why dentists would call upon you for your service?
Great question. Really, maybe they're looking at their numbers and realizing that, we're not exactly where we need to be. Maybe we're a little bit concerned that we might not be tapping into the periodontal disease that's really in the practice that we're not diagnosing and treating. Sometimes they get a little concerned about that. Or they just want to help hygiene learn how to build a practice, and that's what we do best.
All right, now speaking of profits in the hygiene department, what do you think the fastest way, I guess, dentists could jump into that area?
Really, the fastest way is to make sure that you have a really great, clear, written, comprehensive perio treatment protocol. And that is really also the best way to take care of our patients, because then we can ensure that they're healthy. And what we do before we ever go into a practice is we really look at the infrastructure, we look at the schedule, we look at the staff, and we make sure that before they're implementing any kind of protocols that they've got the infrastructure there to support it. They've got places in their schedule for this so that they can just hit the ground running and really see a big jump in their profits very quickly.
Good. Now, what about one of the hidden obstacles here I've written down in my notes? What do you think one of the hidden obstacles are that kind of holds hygiene teams back from being truly profitable?
Yeah, so a lot of times they come to these meetings and we get all fired up and we get ideas, and then we go back and sometimes we just hit a brick wall. And
it happens.
It's those obstacles, and one that I see that's really common is their schedule. They just don't have time on their schedule to do the higher productive procedures, and they're just kind of turning and burning through pro-fees, and they get tired, and they don't have any way to get the patients in to implement these new services and protocols. So we look at that and we help them clear that obstacle and make room for those things so that they can really.
So we'll say time management could be one of their biggest mistakes.
Yes.
Any other mistakes that you may want to?
Mindset sometimes can be it, and sometimes we have to kind of really recognize that we might be holding on to some old beliefs about things and making decisions for our patients sometimes. So sometimes we have to work on the mindset and bringing in new ideas and ways of thinking about how we take care of people.
All right, well, speaking of new ideas, how can we get our dentists excited about hygiene again?
Well,
any quick pointers?
I think one of the areas that isn't tapped into enough is having hygiene help enroll restorative in the practice. It's a heavy load for the doctor to really carry all that. And that's one of the other things that we train hygienists and really the whole team is how to do that co-diagnosis. And it's every doctor's dream to be able to walk into the operatory and the patient is teed up and ready to go. And so that's really what we work on. We've got great interactive workshops that we train the teams to do just that. And
you're making me excited about this.
It's fun. We love it.
Good. Do you want to tell everyone out there, of course, how to get more information about your company? Maybe give us your website as well?
Sure. Please go to inspiredhygiene.com, and actually when you go to our landing page, you'll notice we have a free CD there that anyone is welcome to get. It's the top 3 ways to increase hygiene co-diagnosis. So go check us out.
Great. Sounds good. Rachel, thanks so much for coming in.
Thank you.
I appreciate it.
My pleasure.
You have a great day.
Thanks, you too.
Thank you.